Good evening, everyone, and welcome to Weighty Listening Prowess. This is me, 𝐎𝐿𝐬𝐿 𝐋𝐢𝐬𝐭𝐞𝐧𝐢𝐬𝐿 joining you from 𝐎𝐿𝐬𝐿 Academy. Yes, we've come with yet another Weighty Listening Live to help you with your listening. Usually we come on Wednesdays, and today we're coming on Thursday. This is just an arrangement for this week, but in the upcoming weeks we'll be on Wednesdays itself. So all right, so how is your preparation going? Are you all preparing really well? Is everything going really well? How is the weather? It's almost flooded. Kochi seems to be flooded because of the heavy rains. And how is it in your place? Are you all safe? Make sure you're all staying safe and practicing your listening, reading, writing, and speaking and everything. Okay, so about OET listening, as you know, we focus on each part, like part A, part B, and part C. In part A, you have 24 questions. In part B, we have 6 questions. And in part C, we have 12 questions. And I've told you, if you are aiming at a B score, then you need to get a minimum of 30, 32, 39, that is B. So for that, you should try to get 23, 24 in your part A, and then 4 in your part B, and then 8 in your part C, like 4 for each extract, 8, or altogether 8 out of all the 12 questions that you have. So that's how you have to do it, and that's how you have to focus. That's how you have to turn your focus. Today in our live, what we usually do is we do part A extract 1 in one live, then we do part A extract 2, and then in the next live we'll be doing part B, then part C extract 1 and part C extract 2. In today's live, since in the previous live we did part A extract 2, we'll be doing part B, 6 questions. So you have part B, 6 questions here. If you look at the audio, you'll be able to find some words, some phrases in the audio. This audio, you'll be able to write the answers, whether it's option A, B, or C, only if you know the meaning of those words. So after you guys try it on your own, and if you're making those questions wrong, we'll be discussing whether you make it wrong or not. We'll be discussing each and every question in detail with the help of audio script, and I will mark the answers there, and also I've given the meaning of those words in that audio script. So if you're referring this audio, it would be very useful for you to learn those words, so that next time you hear that in another audio, you'll be able to answer it. So the answers are being decided by the meaning of those strange phrases. Okay, if you don't know the meaning of those phrases, then you wouldn't be able to write the correct answer, because they've given the answer in a different form. So that is one thing that you need to be careful of. That is the peculiarity of this material. So for that reason, it might seem a bit tricky, but other than that, it is a very simple material. You can try to get 6 out of 6, but you know, just like this. Now I said we'll be learning those phrases. When we're discussing the answers, I'll be explaining that in detail, and we'll be learning it. But for exam, what will you do? You try different material. It's not possible for us to learn the meaning of each and every word in the world and to know the meaning of every idiom or phrase. Okay, we would learn some things and then we would go. So what if you come across a word or a phrase that you have no idea about when you went for the exam? What will you do at that point? What can we do? There is nothing we can do except making a good guess out of it. Depending on the situation and the options, just make a good guess and go for it. Okay, don't leave any answer, any question unanswered, because you don't have negative marks for wrong answers. So just make a guess and write something. Yes, so we have some people saying good evening. Yes, Jimmy Joseph, good evening. Shanta, good evening. Deepika, good evening. Nabi Biju, good evening. Ramya Anish, good evening. Okay, so thank you so much. Yes, Tina, Binesh, good evening. So happy to see you all here. We're so happy, and I hope you're all doing good and you're all safe. So are you all safe? Let me know in the comments, because I know that in some areas it's really flooded and some houses are actually underwater. So a lot of people are struggling, and we hope things would get better soon. So I hope, Mega Charles, good evening. Yes. So we have some new people here. We have some people, the regular viewers here. Yes, we're happy to see you all here. And I hope this live would be of a great help to you all. You will learn something new today. So those phrases and what would you do? So you would make the best guess out of it. So that happens. I mean, that's what we usually do, like depending on the circumstance and considering the things they've said before, considering the question, just make a good guess and write the answer. Okay, so that is what you have to be careful about, and the remaining things I will tell you when we discuss the answers. And while you're doing this thing, make sure you're able to focus on it. Okay, you're just doing part B now, so put in 100% of your attention and effort, and make sure you are able to get 6 out of 6. So every time, like I told you, though we say if you want B, you need to get 33. We are aiming at 33, 34 to keep it safe. So for that, you need 22 for part A, 4 for part B, and then around 8 for part C. Though, even though we say that, when you practice, I will say you should always try to get full. You should try to get 24 on 24, 6 out of 6, or you can make one mistake or so. Just make one mistake. Don't give a room for more than that. Why? Because, you know, when you go for the exam, you'll be under a lot of pressure, you'll be under a lot of stress, and your performance wouldn't be, or may not be, as great as what you did when you were in the when you were practicing it at home or something. So make sure you are able to you're able to get a really good score when you're practicing at home. And this material also, why I'm telling you that you should get 5 or 6, not even 4. Why? Because you're just doing your part B, and you don't have to have as much as focus, like when compared to when you're doing a full material practice. This is just one part, this few minutes. That's the only time when you have to be focusing. And these questions, so you get more attention, you'll be able to focus more, so you should be able to get really good scores in this. Okay, and after that we will be discussing, I'll give you time to copy down the questions, and I'll also give you, or you can take a screenshot on another device, so that when we discuss it will be easy for you to follow. And after which we will discuss the answer, and after discussing the answers I will show the question and paper with the answers marked on it. Okay, so for exam, how do you mark your answer? Use darken the circle, and make sure you're not writing anything on the left hand side, and you're making any notes or whatever that is on the right hand side. So listen to every part, every word of this audio carefully, and if you want to make notes, make sure you make the notes. All right, so now I'll show. Are you all ready to do it? Do you all have a book or a paper and pen with you? Are you all ready to do it? Yes, let me know in the comments. So if you're ready, without wasting much time, let's look at the material. So now the material will be displayed on the screen, and the audio will also be played, so you'll be able to see the questions on the screen, and you will be able to hear the audio.
Part B. Part B, questions 25 to 30. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. Now look at question 25.
You hear an ED nurse talking to the relative of a patient who has been recently admitted.
Did you want to talk to me, Miss Tanaka?
Oh, yes, you see, I just wanted to let you know that my father, well, as you know, he's recently been diagnosed with dementia. Most of the time it's not an issue and his spats never last long. It's just that I wanted to prepare you. Sometimes he's really not himself.
Okay, Miss Tanaka, I think I understand. Can your father become aggressive?
Yes. I mean, I think it's just that he gets frustrated sometimes. He can't remember things, and I think it's scary for him. He was never, ever like this before his dementia, and those periods, well, they really don't reflect his true character.
Of course. Thanks for letting me know.
You hear an obstetrician describe a caesarean section to a pregnant patient.
Labour can progress differently for different people. In some circumstances, if labour is longer than expected, and if we detect that the baby is distressed, then we may have to consider an emergency caesarean section. It's a procedure that we perform in theatre, and it is carried out under spinal or epidural anaesthetic, so that you don't feel anything, but you will be awake. A screen is placed across your body, so you don't have to see what's being done. We make an incision in your tummy and womb, just under your bikini line, to remove your baby, and then stitch up the wound. It takes around 40 minutes, and your birth partner can be there at all times. Does that make sense?
You hear a GP and his practice nurse discussing their yearly schedule.
In September, we'll have a lot of new patients, as the first-year university students will all register during freshers.
Yes, we were really run off our feet last year, weren't we?
Yep, it was a madhouse.
Do you think we should hire agency staff to help out for the first couple of weeks this time around?
Well, I think part of the problem was that last year Dr. 𝐎𝐬𝐬 and Nurse Fletcher were both away. Dr. 𝐎𝐬𝐬 went to Costa Rica and Nurse Fletcher had the flu.
Oh, right, I remember. Well, we can't do much to prevent staff illness.
No, but we can ask people to avoid booking time off in those first 3 weeks.
Okay, I'll send an email out today.
You hear a nurse prepare a patient for a flu shot.
Good morning, Mr. Henderson.
Hi.
Dr. Ray has recommended that you get a flu immunization shot before you're discharged. I've got the injection ready to give you. Are you allergic to anything?
I'm only allergic to latex and penicillin. I don't know if I want the flu shot. The last time I got the shot, I got sick.
I'm sorry that happened to you. What kind of symptoms did you have after that last flu shot?
I got a runny nose and a headache, and my arm felt like someone punched me.
Sometimes the flu shot can cause reactions like a sore injection site and headache. Other common symptoms include being tired, muscle and joint aches, shivering and fever. All of these symptoms can be seen with the flu, but the shot can't give you the flu.
You hear a doctor talk to a patient about her injury.
Good morning, Mrs. Bowder. I'll be your doctor taking care of your cut there. What exactly happened?
Oh, it's embarrassing, really. You see, I was just trying to chop some tomatoes for dinner, and the knife accidentally slipped. Oh, I'm so clumsy. I hope it doesn't hurt too much to stitch back up.
Well, we're going to numb the area now with a shot of lidocaine. You'll feel a poke of the needle and a slight burn, but afterwards the area should be numb and you'll feel nothing during the procedure.
Oh, good.
We should be finished in about 10 minutes.
Good. How many stitches will I need? And how long will they have to stay in? I'm really conscious about my hands, so I hope I don't have a scar.
I will only know for sure once I finish suturing, but by my estimation, you might require at least 4 to 5 sutures.
Oh.
They'll have to stay in for 5 to 10 days, and you'll need to come back in to get them removed.
Right.
I'll do my best to try and line up the edges to create as little scarring as possible, but I can't guarantee there will be nothing there.
You hear a trainee nurse asking a senior colleague about the treatment for a patient with chronic obstructive pulmonary disease, or COPD.
I haven't treated anyone with COPD before. What would we need to do differently?
One of the most important things would be to make sure to prescribe oxygen at levels between 88 to 92%.
Okay, so why would that be necessary? If he's having trouble breathing, shouldn't we prescribe higher oxygen levels? Most patients receive oxygen at levels between 94 and 98%.
Well, in healthy individuals, a rise in carbon dioxide would result in an increased drive to breathe in order to eliminate the excess gas.
Right.
However, in some patients with COPD, this response is blunted, and their main mechanism for respiratory drive is controlled by the level of oxygen in the body instead. If the level of oxygen given to a COPD patient is increased too much, it can actually reduce the stimulus to breathe and cause hypoventilation, resulting in an increase in CO2.
Okay. No voice. Hello? Voice not audible. Now you can hear. Okay. Very good, very good. Yes, thank you guys. Hello. Yes, you can hear me now, right? Yes. Sorry. Yes, audible. Yes. 𝐎𝐄𝐓 audible. Very good. So what I was saying was the first thing I asked was how the material was. Was it difficult or easy? Like I said, some phrases were difficult to understand. So did you have that problem? Even now not audible. Jumi Joseph. Am I audible now? Okay, it's easy. So I think I'm audible to others. Is it? Others, can you also comment about whether it was audible or not? Jumi is saying it's not audible. Now audible. Okay, very good, very good. Okay, so you're able to hear me. Yes, yes, yes. See me. Yes, thank you guys. And yeah, what I was saying. Okay, Abhirajan said it was easy. Okay, very good, Abhirajan. And what about others? How did you feel about it? Easy one, but sometimes we couldn't get exact answer. Yes, that's what I said. It is easy, but some phrases, and it's because you don't get the answer because you didn't understand some phrases there. Some phrases are very difficult, and that is causing the problem. Yes, thanks for your response. I'm so happy to see that you were all listening and you were all responding. So you can take down these questions and copy down these questions. That's why I'm keeping it on the screen. Paraphrasing, absolutely. They have paraphrased it. Very good. Yes, they've paraphrased it. So that is the problem. Yes. And that's causing all the problems. So we need to understand. So they're paraphrasing, it's fine, but we should be able to understand it, right? Only then we'll be able to write the answers. Okay. So we have these questions. I'm not dictating it today because it's a long material. Yes, now audible. Yes, very good, very good. So we have few questions. I'll just quickly go through it. 25, you hear an ED nurse talking to the relative of a patient who has been recently admitted. What is the relative doing? Option A, B, C. If you want, you can write it down. Then 26, you hear an obstetrician describing a cesarean section to a pregnant patient. He says that the procedure will be shorter and less painful than a traditional birth, be carried out while the patient is conscious. C, not be necessary in the patient's case. Okay. Now, 27, you hear a GP and his practice nurse discussing their yearly schedule. They agree that the practice should. Then you have option A, B, and C. Then you have question number 28. You hear a nurse preparing a patient for a flu shot. What is the nurse doing? 29. You hear a doctor talking to a patient about her injury. What will happen when the patient returns to surgery? Okay. 30, you hear a trainee nurse asking a senior colleague about the treatment for a patient with chronic obstructive pulmonary disease or COPD. The senior colleague is explaining that giving such patients normal levels of oxygen can option A, B, and C. So Abhirajan is actually giving me the answer for 25th question, which is 25C. He's saying the answer for 25th question is option C, 25C. Okay, 25th question is, you hear an ED nurse talking to the relative of a patient who has been recently admitted. What is the relative doing? Option A, describing her father's medical history. Option B, suggesting ways to interact with her father. Option C, explaining that her father can become violent. Okay, so let's see. So you saw the question, right? You hear an ED nurse talking to the relative of a patient who has been recently admitted. What is the relative doing? What is option A? Describing her father's medical history. Medical history. She's describing, suggesting ways to interact with her father, explaining that her father can become violent. So part B, questions 25 to 30. In this part of the test, you will hear 6 different extracts. In each extract, you will hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. Now look at question 25. So you can all write your guesses in the comment box, okay, what you think is the answer. You hear an ED nurse talking to the relative of a patient who has been recently admitted. Okay. So what is the ED nurse saying? Did you want to talk to me, Mr. Abnaka? Relative. Oh yes, you see, I just wanted to let you know that my father, well, as you know, he's recently been diagnosed with dementia. Most of the time it's not an issue and his fits never last long. It's just that I wanted to prepare you. Sometimes he's really not himself, so she's warning him. Here we cannot see him talking about any medical history. Okay? Yes, so the ED nurse is saying, oh, okay, Mr. Naka, I think I understand. Can your father become aggressive? So here, aggressive, that is the question. And if you look at option C, they're saying violence. So first one is medical history. Now we can see her talking about medical history, so we're eliminating that option. And we cannot see them talking about interaction or anything. The question is, can he become aggressive? Aggressive is a synonym of violence. And the relative is saying, yes, I think it's just that he gets frustrated sometimes. He can't remember things, and I think it's scary for him. So he was never ever like this before his dementia and those periods. Well, they really don't reflect his true character. Okay, so what is she saying? That he can become violent, aggressive. Option C is the answer, and those of you who wrote option C as the answer, your answers are correct. Abhirajan, your answer is correct. Jumi Joseph, your answer is correct. Adri Radish Adi, 25C, your answer is correct. Okay? He gets frustrated sometimes and he can't just remember things. And I think it's Mega Charles is also saying it's option C. Very good. Okay? Now we'll look at the next question. So, ED nurse is saying, of course, thanks for letting me know. By that, it's over. Now let's look at the next question. Question number 26. You hear an obstetrician describing a cesarean section to a pregnant patient. He says that the procedure will be shorter and less painful than a traditional birth. Okay, in the audio, you'll hear them talking about it being pain, about the pain and time. But you will not be able to see them saying it is lesser than, less painful than, or shorter than a traditional birth. So option B, be carried out while the patient is conscious. Okay. Option C, not be necessary in the patient's case. Okay. So Abhirajan is saying 26B. All right, let's see. Okay. You hear an obstetrician describe a cesarean section to a pregnant patient. Labor can progress differently for different people. In some circumstances, if labor is longer than expected, and if we detect the baby is distressed, then we may have to consider an emergency cesarean section. So if the labor is longer, so here they're saying if the labor is longer, they'll have to go for it. They're not talking about the delivery, okay, or the birth. It's procedure we perform in theater, and it is carried out under spinal or epidural anesthetic, so you don't feel anything. So that means it won't be painful, right? But you will be awake. You will be awake. So here you cannot see them saying it would be less painful than traditional birth. They're just saying it won't be painful. But what they're saying, you will be awake. Awake, that means conscious. They're using synonyms. So option A is eliminated because they're not saying it is shorter or less painful than a traditional birth. Okay, so option A is eliminated. Option B, be carried out without while the patient is conscious. So you will be awake, that be conscious, you will be awake. So we can eliminate, so option B is the answer. Not be necessary in the patient's case. They're not saying anything like that. Alright, if you listen to the rest of it, they're saying a screen is placed across your body so you don't have to see what's being done. We make an incision in your tummy and boom, just onto your bikini line to remove your baby and then stitch up the wound. It takes around 40 minutes and your birth partner can be there at all times. Does that make sense? So they're just saying it takes 40 minutes. They're not saying again it is shorter than traditional birth. So we're eliminating option A. They're not talking about, not in this patient's case. So all that they're saying is it would be carried out and the patient will be conscious, will be awake. Option B is the answer, 26B. Yes, Abhirajan's answer is correct. Adra Ratishati, your answer is correct. Jumi Joseph, your answer is correct. Meka Charles, your answer is correct. Very good, guys. Good job. Okay. So now we'll look at question number 27. You hear a GP and his practice nurse discussing their yearly schedule. They agree that the practice should, option A, hire agency staff to help during the busier weeks. Option B, avoid taking holiday in the beginning of September. Look after their health to lower the likelihood of sickness. All right, let's see. Okay, you hear a GP and his practice nurse discussing their yearly schedule. GP is saying in September, we'll have a lot of new patients as the first year university students will all register during freshers. Nurse, yes, we will really run off our feet. Okay, last year, weren't we? We will really run off our feet. That means we were really busy. Last year, weren't we? GP, yep. So if you don't understand what is the meaning of run off, then you might struggle a little bit. You'll be like, okay, what is he saying? So run off means we were very busy. Okay, weren't we? GP say yes. It was a madhouse. Madhouse is like a scene that is where there is extreme confusion or chaos. Uproar means a loud and impassioned noise or disturbance. Impassioned means with a lot of emotion. So when there is an extreme confusion, we call it madhouse. So the nurse is saying, do you think we should hire agency staff to help out for the first couple of weeks this time around? They're asking about hiring an agency nurse, and we have that as an option here. Hire agency staff to help during the busier weeks. Okay, so shall we take that as the answer? No, we should see what they're saying. GP, well, I think part of the problem was that last year, Dr. Igwe and Nurse Fletcher were both away. Dr. Igwe went to Costa Rica and Nurse Fletcher had the flu. Nurse, right. So when she proposed an idea of hiring an agency nurse, he's saying it was because last year these people were away. One had flu and the other one was away at Costa Rica, that we had a problem. So we don't have to, that means they don't have to hire an agency nurse. So hire agency staff to help during the busier weeks. That can be eliminated. So option E is eliminated. And then what they're saying, well, we can't do much to prevent staff illness. So we have an option C, which is saying look after their health to lower likelihood of sickness, but we cannot take it because they're saying we cannot do much to prevent or avoid staff illnesses. But what is the GP saying? No, but we can ask people to avoid booking time off. Not the point. Ask people to avoid booking time off, to take a period of absence from the work due to illnesses. Okay, what is booking? Avoid booking time off. Booking time off means just taking a period off from work because you're sick. So, but we can ask people to avoid booking time off. If you don't understand the meaning of that, you won't be able to write the answer. Okay, avoid booking time off. That means take time off from work because you are sick. Okay, okay. So we have an option, avoid taking holiday in the beginning of September. That is the same thing they're saying, but we can ask people to avoid booking time off in those first 3 weeks. In those first 3 means first 3 weeks of beginning of September. Okay, nurse L sent an email out today. So nurse is agreeing on that as well. She's saying she'll send an email out today. Okay, so your answer is option B. 27, your answer is option B. Abhirajan has given the answer. Very good. Others, was it a difficult question? Did it trouble you? Not about the nurse's opinion. Absolutely. Yes. They're not asking about nurse's opinion, what they agree on. Very good. So they're agreeing on this thing. The nurse is saying, I'll send the other thing. What they're saying, nurse is giving a suggestion. But the doctor is not agreeing on it. Yes, option B, Mega Charles. Yes, very good, very good. See, this is the way you should be learning it. You should be able to say why it was the answer and why it was not the answer. So you're able to say it. Very good, very good. I'm so proud of you guys. Ajit A, yes, very good, very good. 27B, good job, guys. So now we can look at question number 28. You hear a nurse preparing a patient for a flu shot. What is the nurse doing? Explaining why the flu shot is necessary. Option B, discussing why the flu shot causes reactions. Describing common side effects of flu shot. Okay, let's look at it. You hear a nurse prepare a patient for a flu shot. Nurse, good morning, Mr. Henderson. Dr. Ray has recommended that you get a flu immunization shot before you're discharged. I've got the injection ready to give you. Are you allergic to anything? Patient, I'm only allergic to latex and penicillin. I don't know if I want the flu shot. The last time I got the shot, I got sick. Nurse, I'm sorry if that happened to you. What kind of symptoms did you have after the last flu shot? Patient is saying I got a runny nose and a headache and my arm felt like someone punched me. So nurse is saying sometimes the flu shot can cause reactions. So she's talking about reactions. Okay, so we might go for option B, which is saying discussing why the flu shot causes reactions. So she's not saying why it is causing reaction. She's describing the reactions. Can cause reactions like a sore injection site and headache. Other common symptoms, now symptoms, include being tired, muscle and joint aches, shivering, and fever. All of these symptoms can be seen with the flu, but the shot can't give you the flu. Okay, so here she is explaining the reactions, the side effects, the symptoms of the flu shot. She is not explaining why it is necessary. You cannot see that, so we're eliminating option A. You cannot see her discussing why it causes the reaction. She's just describing the reaction. So describing some side effects of the flu shot, side effects or the symptoms, okay, of the flu shot. Option C is your answer. Abhirajan is saying option C. Jijo is saying option C. Jimmy Joseph is saying option C. Very good, guys. That is the right answer. Now let's look at question number 29. You hear a doctor talking to a patient about her injury. What will happen when the patient returns to the surgery? Option A, she'll have her stitches removed. Option B, a doctor will stitch up her wound. And option C, they'll see if the wound will scar. So they're talking about scar, they're talking about stitches and everything. But let's see what is the answer. You hear a doctor talk to a patient about her injury. Doctor: good morning, Mrs. Bowder. I'll be your doctor taking care of your cut there. What exactly happened? Patient: oh, it's embarrassing, really. You see, I was just trying to chop some tomatoes for dinner and the knife accidentally slipped. I'm so clumsy. I hope it doesn't hurt too much to stitch back up. Doctor: well, we're going to numb the area now with a shot of lidocaine. You'll feel a poke of the needle and a slight burn, but afterwards the area should be numb and you'll feel nothing during the procedure. We should be finished in about 10 minutes. Patient: oh, good. So here in all these places we're seeing what they're going to do, the procedure, explaining the procedure. Okay. Oh, good. How many stitches will I need? How will I have to stay in? I'm really conscious about my hand, so I hope I don't have a scar. Doctor: I'll only know for sure once I finish suturing. Suturing means to stitch up a wound or incision. So it is another word for stitch up, okay? But by my estimation, you might require at least 4 to 5 stitches. They'll have to stay in for 5 to 10 days and you'll need to come back in to get them removed. So when the patient returns, the key word, that means come back, we'll have to remove the stitches. I'll do my best to try and line up the edges to create as little scarring as possible, but I can't guarantee there will be nothing there. Okay? So that is what you're saying. That is what you're able to see. That is 29 answer is, it is not that the doctor is doing the stitching up, suturing now. And they're not talking about seeing if they'll have a scar. They're saying she needs to come back to get this thing removed, the stitches removed. So option A is the answer. Okay? 29A. I can't see the comments here, so type in the answer for 29th question. Option A. Did anyone write another option? Okay, now we'll look at question number 30. You hear a trainee nurse asking a senior colleague about the treatment for a patient with chronic obstructive pulmonary disease or COPD. The senior colleague is explaining that giving such patients normal levels of oxygen can inhibit breathing rate, will cause lightheadedness, lowers carbon dioxide levels. This might have been a little bit confusing, was it? Yes, let's see. So you're saying 30, the answer is A. Joe is saying 30, the answer is A. Let's see. So you hear a trainee nurse asking a senior colleague about the treatment for a patient with a chronic obstructive pulmonary disease or COPD. Trainee nurse: I haven't treated anyone with COPD before. What will we need to do differently? Senior colleague: one of the most important things would be to make sure to prescribe oxygen at levels between 88 to 92%. Trainee say, okay, so why would that be necessary? If he is having trouble breathing, shouldn't we prescribe higher oxygen levels? Most patients receive oxygen at between 94 and 98. So he is saying 88 or 92. A senior colleague is saying that should be given. So trainee is saying, why should it be like that? Shouldn't we be giving them more oxygen, like 94, 98? That is the normal range, right? We are just giving less than normal. Okay, senior is saying, well, in healthy individuals, a rise in carbon dioxide would result in an increased drive to breathe in order to eliminate the excess gas. Trainee: right. Senior is saying, however, in some patients with COPD, this response is blunted. That means it's weak, or reduce the force of something, reduce. That is, it is weak. And their main mechanism for respiratory drive is controlled by the level of oxygen in the body instead. If the level of oxygen given to a COPD patient is increased too much, That means if you're giving the normal level of oxygen, it can actually reduce the stimulus to breathe and cause hyperventilation. So they wouldn't breathe much, okay? And hyperventilation is a condition where there is an abnormally low rate or depth of breathing. So that means they wouldn't be breathing much because they have oxygen, resulting in an increased concentration of carbon dioxide in the blood, resulting in an increase in CO2. All right, so we have an option C, which is saying lowers carbon dioxide levels. No, that is not the reason. We can eliminate that, and will cause lightheadedness. They're not talking about any lightheadedness, but they're saying if you're giving higher oxygen, that means normal, we're giving lower than normal, so 88, that is what we're giving. So if we give higher, that is the normal here is higher, so that is too much for these patients. If you do that way, that would affect the stimulus to breathe. That means they wouldn't breathe. That would affect the breathing rate. So option A is the answer. Is it clear? So I'll show the answers once again on the screen. And you can check the answers and tell me how much you scored. How much could you score? Could you get 6 out of 6, or 4 out of 6, or 5 out of 6? How much could you score? Which one went wrong and why it went wrong? Were you able to understand why it was wrong, and could you correct it, and things like that? So 25, the answer is C, explaining that her father can become violent. 26, B, be carried out while the patient is conscious. 27, B, 28C, 29A, 38. Kamlesh Ram is saying he got only 4 out of 6 and he's sad. Yes, I'm happy that you're sad when you're even getting 4, because 4 is a decent score. But while you practice, you should be sad when you get 4. For exam, if you're getting 4, it's good, because which all questions went wrong, and were you able to understand why it went wrong, and could you understand your mistake? Okay. Others, tell me, how much could you score? Is there anyone who got 6 out of 6? Just comment your answers. Yes, so except for some words like run off, booking time off, those kind of things, those kind of usages and the meaning, it is all given. You can refer it again. You can try this material once again, and if you're stuck and if you have confusions, if you don't remember the words we learned today, then you can refer the video. It will be available on Neva's Academy page. Okay, so I think it was helpful, and amidst the bad weather, a lot of you showed up, and I'm so happy to see you all here, and I hope it was very helpful for you. If you want to watch lives like this, you have to follow us, and we will be coming with yet another beautiful OET listening live on next Wednesday at 8 p.m. Stay tuned. Bye-bye. Good night. Take care and stay